naturopathic doctor, and I host a live Q&A every night. So happy Sunday evening. Hope you all have a wonderful weekend. Thanks for joining me. And so if you've never been here before, this is our health Q&A. So you ask questions and I give you answers. You just leave your questions in the chat box and I will answer them for you. I also have a whiteboard here where I'll be just talking about different things, different health topics, writing down some things, explaining things out for you as well. So if anybody's just joining us and you're new here, hi and welcome, and let's talk health. So drop your questions in that comment box and I will get to them for you. For cognitive health, we had some great great questions about vitamin D. I've got a lot of questions about that. A lot of people are curious about vitamin D. So that's a good one. What else have we been getting a lot of questions about? Skin health, hair health, gut health, so many different things. So really anything you want to ask me, drop it in the comments and I will answer for you. So tonight I was thinking let's talk a little bit about constipation. It's a common concern a lot of people have. So let's talk about that. So if anybody's just joining us, anybody that is just jumping in on this live stream, hi, welcome, I'm Dr. Amanda. This is Let's Talk Health. This is our health Q&A. I'm going to be talking a little bit about constipation today, but feel free to ask me any questions in the chat and I will answer them for you. Okay, so what are some causes? What can cause constipation? You know, there's a lot, so I'm just going to talk about a few of them, but maybe this is not specifically your cause, but there can be definitely lots of causes. So one cause is poor motility. So basically in our gut, in our intestines, what they need to do is like move the bowels, the stools, everything properly across the intestines. So that way they're able to form, come together in solid bowel movements, and then you pass. So if you have poor motility, that could be a cause of why you have constipation. Another cause of constipation, would be more systemic, but actually if you have hypothyroidism, so that's an underactive thyroid, can actually cause constipation. Whereas on the other hand, if you have the other side of things, hyperthyroid, an overactive thyroid can cause diarrhea. So that's one thing just to keep in mind. Now, you most likely would have a lot of other symptoms. In addition, we can definitely do thyroid talk another time, or if you're watching right now and you have thyroid questions, feel free to ask me. But yeah, that's definitely one thing that can cause constipation. The other thing can be medications. Now, like I said, I'm kind of trying to just give you a variety of things, because sometimes we think if it's constipation, it's just due to what's going on in the gut. That's not always the case. There can be so many other causes of it. So medications, specifically pain medication, opioids, those ones are very common to cause constipation. Sometimes some other medications, some blood pressure medications, also even like SSRIs can also, that's for like anxiety, depression. So that's just one thing to keep in mind before just like jumping to what maybe your constipation is caused by. Look at what's going on and what you're taking. In that case, I will also say supplements. And there's probably, this is one of the main one, it would be iron. Now, there could be other supplements that cause constipation for some people, but pretty much, I'm going to say just the main general one would be iron. So, if you are just tuning in, hi, welcome. I'm Dr. Amanda. This is Let's Talk Health. This is our live Q&A. If you're just joining us, make sure to like, make sure to subscribe, turn on those notifications so you get notified when I go live. I do this every night. You ask me health questions and I give you answers. Tonight's topic, we started off with constipation, but feel free to ask anything. Okay. What else can cause constipation? Well, this is something like microbiome. Imbalance, I'll just call it. But basically, if you don't have enough good gut bacteria, or maybe you have an imbalance of bad bacteria, so maybe there is a yeast overgrowth, can definitely cause it, or a lack of beneficial bacteria. So that, it would be another cause of constipation. So if, if things are going off in your microbiome, maybe you have a yeast overgrowth, maybe you have a bacteria, maybe you have a parasite, sometimes these can actually lead to constipation. Or if you just don't have enough good bacteria, that can definitely cause it as well. And the last thing I would say is just looking at diet. So one would be dehydration, or just not like enough water. Maybe you're drinking water, but you're not hydrated enough. And then two would be lack of fiber. Those are the two things I would say. So, yeah, so let's just kind of recap. If anybody's just joining us, hi and welcome. This is Let's Talk Health. Make sure to like, subscribe, join this health community here. I do a live Q&A every night. The more questions you guys ask, it does help with other people asking questions in the chat as well. So make sure you are, just ask anything that you wanted to know in terms of your health. And I do really appreciate that, and I like helping you out too. So, okay, so let's just kind of recap. We're talking about constipation. So, causes, poor motility, so things aren't moving enough, your intestines aren't helping to properly move things through. Hypothyroidism, if you have an underactive thyroid. Medications like pain medications, anxiety medications can cause that, or supplements like iron, an imbalance in your microbiome. So maybe you have a yeast overgrowth, or you have a lack of beneficial bacteria. And then the next one would be diet, dehydration, or lack of fiber. So these are just some common things. Now there's so many other conditions that can cause constipation. Now really what you want to do is like rule out all other causes, like make sure there's no neurological damage or disease going on. And then once that's all kind of ruled out, then you would want to like think of these that are more so common things that can cause it. Okay. So that's causes of constipation. So I'm just going to erase that. And these videos do get posted after, so if you ever need to go back and like look at something, they automatically will get posted to my channel. So that's why it's always good if you're subscribed and if you're joining the community here, because you can then see when the video becomes posted after it's live.
I have a question here. I have been sick, I have been coughing a lot, and I have not been feeling hungry. What could it be?
Yeah, so it depends how long you've been sick for. If it's something like short term, maybe you've been sick for a few days, a week, maybe what you're having is like a cold or a flu, and then that can definitely impact your appetite. So if the body is sick, you have to think about it's putting all its resources towards your immune system and trying to get your immune cells going to help fight off infection. So just generally, we don't feel hungry when our body's doing that. That's why a lot of times when you're sick, you just don't eat. Sometimes people lose weight. So in that case, what I would say is if like you're not feeling well and you're just feeling off, try to get your nutrients through things like broth, like chicken broth. So for example, if you're sick, not hungry, or really, like chicken soup or like chicken broth, really good to have. It has a lot of nutrients in it, a lot of good vitamins and minerals. So you still want to make sure that you are having something, so that way your body is able to use all those vitamins and minerals to fight off this illness. Another good thing is making a smoothie. And in that, I would recommend adding protein or collagen, so you're getting some sort of protein in there, adding in some berries for good antioxidants, And then doing something like a coconut water is good because it's got electrolytes. So that could be like the base of your smoothie. And then, you know, then you're adding in other things that you like as well. I don't know if you like banana or something like that, you could put in there too. What else? Something like cooked veggies, like even like potato, sweet potato, that's also really good. So possibly what's going on is like maybe you got a virus, or maybe something else happened, and maybe you got a stomach virus or just a respiratory virus, you're sick, you're not hungry, and that can be impacting, you know, the way that you're feeling, so just making sure you're eating. Now, if this has been like long term, if it's been like months, then there could be something else going on. So in that case, you'd want to go get some blood work done or get some examinations done to see if there's something more going on than just like your typical viral or bacterial illness. But yeah, great question. I hope that was helpful. If you have a follow-up question, just feel free to drop it in the comments. If you are new here and if you're just joining us, make sure to like and subscribe, turn on notifications. I'm Dr. Amanda, and I do a live health Q&A every night, so yeah.
How to stop opioid constipation?
That's a good question. So the first thing I would say is like assessing the opioid use and like how long you've been on it for, what the reason you're on it for, and potentially number one would be seeing if there's an alternative option for you. So discussing that with the person that's recommended the opioids and seeing, you know, how you can do something else. Now, if it's more so like addiction, then of course getting help for that would be my top thing to say for that. So one would be just assessing that and seeing there's an alternate option. Then on the other hand, you know, if you've gone through that and it's still something that's needed, then I would say there are some things that you can do just to help with gentle support of bowel movements. Now, we always want to be cautious when we're using things to help with improving bowel movements. So just as a disclaimer, you know, it's not medical advice. You always want to double check to make sure there's no interaction with the opioid you're taking or if any other health concerns or condition. But there are some good things. So one I would say is, and this can apply to actually just general constipation, is a tea. Now, there's one that's formulated. It's called Smooth Move. I believe that's the name of it. And it has a variety of herbs in there with, there's some senna in there. So if you've heard of like Senecot, it uses like the full form of the herb in there, plus some other herbs that are really good just for like calming down the digestive system and giving it a gentle push. Because it's a tea, it's not going to be something super stimulating, like a stimulating laxative that's just going to make you have to urgently go. But generally, if you drink something like that in the evening, it should help with having a bowel movement in the morning. So that's one. The other one would be magnesium citrate. This one is magnesium, so it's great. It's a mineral, really gentle as well. You again take this in the evening. It kind of helps with the nervous system too, and then it helps with drawing water into the intestines to help with supporting a bowel movement there. So there's that one. And then the third thing I would say, just like looking at diet. So diet for sure, because you know, if you're on opioids, a lot of times when we're on pain medication, our appetite cues and our hunger cues are just off. We may not be eating regularly or might not be eating enough, or might be choosing foods that maybe aren't the best. So what I would say is water, electrolytes, like maybe using an electrolyte powder, chia, flax, those are really good things to add in there. And then apples, awesome, really good too. And then just like eating at regular times, so eating like every 3 to 4 hours, just to make sure your digestive system is giving a bit of a push. What else? The other thing you could also do is a belly, like abdominal massage. Honestly, it sounds maybe silly, but just to like get things moving as well, just like to manually help with your movement of like the stools through your intestines if you just do an abdominal massage. So. And so yeah, so great question, because this is applicable to honestly all of this. These are some things that can help with any sort of constipation, and I like them because they aren't, like I said, super stimulating laxatives, like something like a lot of medications, like sometimes Miralax and things like that. Your body just like becomes dependent on its use, whereas these are more so gentle things, and your body's able to use these to kind of assist itself. So I hope that was helpful. If you have a follow-up question, drop it in the comments. And if you're new here, be sure to like, subscribe, and join our health community. And thank you guys for your questions. I do find it helpful, and I like answering them for you.
My weight is not increasing. Please help me increase my weight.
Okay. So you want to gain weight. So the main thing I would say looking at is, well, okay, so if you're actively really trying to gain weight and you haven't gained weight, there could be a couple of things going on. One, honestly, could be genetics. So just like looking at your genetics, if generally everybody in your family is pretty thin and has the same issue, sometimes it can just come down to that. Not saying that's an excuse or anything, but it could be a reason. The other thing is looking at if there is some sort of metabolic condition going on. So for example, an overactive thyroid. So in that case, when your thyroid is overactive, it's called hyperthyroidism. And in that case, you can actually lose weight or have difficulty with gaining weight because of the way that the thyroid hormones impact your metabolism. So those are kind of some things I would say first, just kind of looking at if there's an underlying condition, or potentially is there something else going on in the body that can be impacting that. So once you've kind of ruled out those things, then what you would want to do is then I would say assessing your diet. So whenever we're trying to gain weight or lose weight, it really does come down to calories and like the quality of the food. So I guess I can erase this too. Oh, so we'll say like trying to gain weight. So I mentioned one, look at thyroid. That would be one thing I would say to look at. Also, another thing would be stress. Like if you're constantly in that like fight or flight response where your body is stressed, you may be losing weight or having difficulty with gaining weight. Okay, and then what you want to do is we want to look at diet. So calories, and then quality of food. So if you're trying to gain weight, like you want to make sure you're doing it in a healthy way where you're still able to get it from whole foods and healthy foods. Of course, if you go and eat foods that are higher in calories or maybe aren't the most nutritious, it's not going to really give you much benefit. So what I would say is fats are really good because they have like more calories in them, and they are generally really good and really healthy for supporting your overall cognitive health and cardiovascular health. So things like avocado, nuts, and seeds, having those as snacks. The other thing I would say is looking at the volume of your meals. Maybe if you get full easily, maybe you need to do like more meals a day. Maybe you need to have 5 meals a day. So like 3 to 5 meals a day. I would say trying to get in it through a smoothie, because what you can do is like you can really add a lot into the smoothie and then you're just drinking it, so it doesn't always feel like it's a whole separate meal. So adding in like seeds, like flax seeds, like chia, adding in protein. You can add like a weight gainer in there as well sometimes. So that's what I would say, diet, just really focusing on having fats, having more meals, and having something like a smoothie. And then the third thing would be, you still want to make sure you're exercising, but you want to do weight, strength training. So building muscle mass is really important. Now, if you're already doing all of this, it's not working, then I would definitely say you want to look at something like this. What's going on? Is there something with the thyroid? Is there genetic reason why you're like that? Is there something with the stress going on? Is there a blood sugar issue with maybe sometimes, with diabetes can happen where you actually lose weight at the beginning. So that's kind of what I would say to focus on. So if you have a follow-up question, let me know. If that was helpful, like the video, subscribe, join our health community here, and feel free to ask any other health questions.
I've been in bed for 4 days with food poisoning from KFC. Please help.
Oh no, that sounds awful. Oh my goodness. So for the person that I wrote this down for, I'm gonna erase it, but yeah, you can always go back if you need to. Like I said, this video will get posted. So that sounds awful. I mean, 4 days, that's quite a bit to be, it must have been really, really not good. So I'm gonna give you some tips of what you can do for food poisoning. Okay, so one, really important is to stay hydrated. Like, make sure you are staying hydrated, because when you have food poisoning, you're likely to get dehydrated, and that's not good because then you can end up in the hospital. So hydrate. And for this, I would say water, plus you can do electrolytes. You can do coconut water, it's really good. And then I would say also bone broth. If you can get some bone broth, if somebody can go grab you some bone broth, really good, especially for the gut, because what's happening now is there's going to be some, what we call like dysbiosis, so like an imbalance of your bacteria. There could be some inflammation going on. So bone broth is so good and so soothing for helping your gut. The second thing I would say to do would be, now again, this is education, not medical advice, so double check that this is safe for you to do. But there's a specific strain of probiotic called S. Boulardii probiotic. This is specifically helpful for rebuilding the good gut bacteria, especially if you were on antibiotics, if you had food poisoning, if you are having diarrhea. It can be very beneficial for helping with that. So you'll usually find it in a capsule form. Generally, each capsule has about 5 billion, so anywhere from like 5 to 10 billion CFU is generally like a general dose for that. So that one I would say for sure is important. And then the third thing I would say is doing some gut soothing teas, or gut healing or soothing tea. So there is chamomile is really good. Really good for like if you're having aches and pains and cramps and gas. That one's really good. There, the other one might be harder to find this one, but it's called marshmallow root. Has nothing to do with the marshmallow. But marshmallow root is really good for soothing any sort of inflammation or irritation. So, yeah, and then just monitoring yourself, making sure, you know, that there is somebody watching you as well, because we don't want you to have to end up it being more serious as possible. So hydrate. If you have food poisoning, hydrate. Look into Saccharomyces probiotic, and then some teas. I would say that would be a good start. And then trying to still eat, you know, your regular diet. There is the oh man, I'm forgetting, the brat diet. It's called. Basically, it's banana, rice, apple, and toast. Those are things that are usually like easier to tolerate if you have an upset stomach. So just things like that, applesauce, something that's just more broken down and easy for you to have. So that's food poisoning. If you have a follow-up question, let me know. I hope you feel better. Make sure to like this video, subscribe, join our Let's Talk Health community here, and turn on your notifications.
Can you repeat the first one on the list of constipation? Does the color of the stool have a valid meaning?
First one on the list of the constipation. For the list of the causes, or was it the treatment? The treatment was the Smooth Move tea. That's what I had said for treatment for constipation. For the causes, what did I say? I said motility. That was the first thing on that list. Does the color? Yeah, the color does have a lot to do. I have a video on this. One of my shorts is all about the different colors of poop. So if you haven't seen that, go check it out. But yeah, for sure, the color does play a role. So for example, if it's brown, any range of brown, that's good. If it's green, can be normal, but can also be from food. Or, for example, the case we're talking about before, food poisoning, or bacteria, something going on can cause that. If you got yellow, that's usually fatty stools, so you're not digesting fat well. Could be liver or gallbladder concerns. If it's red, we're thinking maybe there's blood, maybe there's food, like something like, for example, like beets or food coloring can cause that. Kind of the main things for that. If it's black, that could be medication, supplements, iron, Pepto-Bismol. Could also, again, anything could be food. Oreos, honestly, if you have like Oreos or a lot of chocolate cake, that can cause that. But those are kind of like the main colors that I would say for poop colors. Now, if there's a question you have about a specific color, let me know. I will answer that for you. And then if I answered your question for the list of constipation thing that you asked about, or if I didn't answer, just let me know. But yeah, that's what I would say. So thank you for your question. And also, if you're new here, be sure to join, subscribe. If anybody's just joining us, hi and welcome. This is Let's Talk Health. I'm Dr. Amanda. I'm a naturopathic doctor in California, and I'm here to answer any health questions you have. So we have a nightly live Q&A where you can ask any questions in the comments, and then I will do my best to answer them for you. Of course, it's not medical advice. It's just to give you some tips. That way you can go and do your own research about everything. So yeah, let's see if we have any other questions to answer right now.
Who do you prefer, Dr. Gordon or Mark Hoffman?
Dr. Gordon. I'm not sure who either of those doctors are, if you could give me some more background information on them. Mark Hoffman.
What would you suggest to help someone digest fat better? What can you do to fix it?
Such a good question. I'm so glad you asked. How can we digest fat better? Digestion. So the main thing with fat is bile. So basically, bile is something in our body that our gallbladder will release whenever we're eating, and it goes and it will digest fat. Now, sometimes you may have something called like bile stones or a sluggish gallbladder, or your liver's not working the greatest. So maybe your body isn't putting out enough bile. Maybe you've had your gallbladder removed where you're not getting that bile release on demand. So that's one thing I would say, is to like kind of look into that. But you can actually take a digestive enzyme with bile. Like, you want to make sure it has the bile in it. With bile and lipase. That is the one that's going to digest fats as well as that. So, because there's so many different digestive enzymes out there. So just look at the ingredient list. If it has bile with lipase, that's good. It can have other things as well, no problem. But that's going to be the main thing to do to help with digesting fat. And then you take it before you have your meal, with every meal. Combination of having that with your meal can help it. The other thing I would say is, I really love bitters. So they're called like digestive bitters. These are a blend of herbs that help your body digest fat and other compounds as well. So for example, there's one called gentian. There's burdock. Turmeric can also be good too. Fennel. These are just some examples of bitters. So generally what you'll do is you'll be able to find this in a tincture form. So for example, if you're from Canada, there's one from St. Francis Herbs, really good one, digestive bitters there. And basically these are little drops, like they're little liquid drops that you drop them in water, or you can drop them directly in your mouth, and then just drink it before your meal. So I would say that's like the main thing for helping out. The reason why I like bitters is it kind of like teaches your body how to get digestion back properly on its own. So not just only relying on the bile from a supplement form, but getting your body to work better and effectively at digesting fat. So if that was helpful, let me know, give this video a like, and then write any follow-up questions that you might have in the comments. And if you're new here, make sure to subscribe and join our health community. I talk every night where I have my Let's Talk Health live stream, and I answer your questions. So thank you. Let's see if we have any other questions. Any other questions? No. Okay.
If it's the liver, I know people take milk thistle. How long should you take that?
Yeah, so milk thistle can help out with the liver. So I usually say something like a herb. You can do it for about like 3 months is usually a good amount of time to take something like that to help. 3 to 6 months, and then it's nice to sometimes cycle off of it too. So then give yourself about a month break, 4 to 8 weeks or 4 to 6 weeks break, and then see how you're doing and see if you need to add it back in again. It's nice to just take a break from some things, like herbs especially, because it just allows your body then to regulate on its own. Now with something like milk thistle, sometimes there can be interactions with medications, because anything that really kind of works on the liver, even turmeric as well, where what your liver actually processes medication, and it goes through like different processes to process medication. So if you're taking something, might interact with that. So that's just one thing I would say to keep in mind, especially anything that you really take, just always double check that it's okay for you to take.
Do you take breaks with the digestive enzymes?
I would take breaks with the digestive enzyme, absolutely. Yeah, again, you want your body to be able to regulate when it's not needing it. So both of these you could do like a 3 to 6 month trial, see how you feel, and then give a break. With bitters, I'm not as concerned with like you having to be dependent on them as something like you're getting the bile directly, because the bitters will help your body produce that bile and produce those enzymes on its own. But yeah, I would still take a break for both. Yeah, great questions. Thanks for the questions. Okay, so wow, we got a lot of great gut health questions today. We talked about food poisoning, fat digestion, we talked about how to improve your weight, we talked about constipation, so lots of great questions coming in the chat tonight. So feel free to ask me any other questions, and if you're just joining us, if you're just hopping on, welcome to Let's Talk Health. This is our live Q&A. I'm Dr. Amanda. I'm a naturopathic doctor, so I like to take a holistic approach when it comes to improving health, so I try my best to answer your questions and give you health tips. All right. Okay, so that was fat digestion. That's what I would say would be the main things to help out with that. I think we already covered the constipation pretty good.
What are your tips for dehydration?
So for dehydration, so for water intake, you want about half your body weight in ounces of water, if that makes sense. So, for example, let's say you weigh 100 pounds, you would drink about 50 ounces of water. So that would be my one tip, is first tip would be seeing how much water you're having. Now, if you're meeting that goal about getting half your body weight in ounces, then you may need to, and if you're still like really thirsty or you're not really feeling hydrated, then two, I would say to look into certain health conditions. So for example, diabetes is one. Maybe like maybe you're dehydrated because of that. So diabetes can lead to that. Diarrhea. I know that's not really a condition, but like if you maybe have like colitis or something that's causing diarrhea, those would be like kind of the main things to look into. Look into your thyroid. So that's what I would say there. And then 3 would be to, it doesn't hurt to like take an electrolyte to help out with improving the way your body absorbs the water. So maybe, you need to do something like that. So with the electrolytes, it's gonna have sodium, potassium, and magnesium. And that can help your body with absorbing it better. Oh, the other thing I guess health conditions would be looking into like kidney disease too. For sure. Kidneys do a lot of filtering. So that's what I would say for dehydration. And then you can also like hydrate through diet. So things like fruit are really good, and vegetables. So seeing like if you're eating enough fruit and veggies. If you don't like water, like plain water on its own, you could do like a herbal tea. I would suggest like avoiding high amounts of coffee, caffeine, large amount of caffeine, because that can actually dehydrate you. So that's just one thing to keep in mind. So yeah, we got quite a bit here. Let me know if that was helpful in terms of the question you asked about what can you do for dehydration. I would say looking at all of this, seeing where you're at, and then if you found that helpful, just feel free to like the video, subscribe, join our channel, and welcome to the Let's Talk Health community.
Do you recommend bioidentical hormones? And if so, what delivery method is best? Pellets, triages, or oral?
Yeah, so great question. So in terms of like my practice, like yeah, I do use bioidentical hormones, depending on the situation and the current health status of that patient. So whenever we're doing bioidentical hormones, we need to assess risks and benefits. So that's one thing I would recommend talking with whoever is providing that for you. Is it going to give you more benefit than cause a risk? So for example, if you currently have cancer, that like the risk is going to outweigh the benefit if you were to take bioidentical hormones. If you have heart disease, high blood pressure, cardiovascular disease, what's the risk of that, and like what would be the benefit to outweigh that? So that's one thing I would definitely say whenever you're doing bioidentical hormones, is to look at that. What's the reason for it? Are you in menopause or perimenopause, or are you male and you have low testosterone? Like seeing, what the reason is for it, seeing what other options there are, because there are other options. You don't have to always do the hormones. You can do herbs and herbal remedies and stuff, and seeing if that's an option for you. It really just comes down to that. So risk and benefit in terms of bioidentical hormones. In terms of mode of delivery, I would say I go more based on like what would be best for that patient, what they're going to be consistent with, what they're going to do. So for example, something like a cream. I've had patients say, they don't really like a cream, it can be a little messy, and sometimes they forget to put it on. So if you're forgetting to use it, then that's not going to be worth it. So maybe in that case, a troche is a better option, or a patch, like for example, an estrogen patch or something like that, or testosterone injection. There's so many different methods out there, right? So I think it just comes down to you as the consumer and the way that would be best for you. Now, if we're talking about things like estrogen, we don't want to do oral estrogen. There's more risk with that one, so I wouldn't do that one orally. Estrogen would be topically for sure. What else? Progesterone is fine oral. Actually protects, if you have a uterus, it's protecting the uterus if you're using it with estrogen. But yeah, I'm sure you probably have more questions about that, or if anybody else has questions about bioidentical hormones, let me know, and feel free to drop any questions in the comments. I will answer them for you, and be sure to subscribe and join our health community here too. And like the video, really helps get it across the YouTube live stream. Yeah, but great questions about that one.
Anything on ED, good food, best Viagra?
Mm-hmm. So with that, I would say looking at, what could be causing that, because so many things can cause that. It could be psychological. It could be cardiovascular related, like blood pressure issues, diabetes can actually lead to that. So we'll definitely talk about what you can do to help with that, but I'm always for like looking at what the root cause is or what the approach is, because if you're just taking something, it's not going to really fix what's going on. So so for that, I would say looking at things like blood pressure, cardiovascular disease, diabetes, psychological, if there's something going on there. What else? Thyroid can also play a role with that. Testosterone, of course, hormones, not just testosterone, but looking at the other hormones like DHEA, DHT, estrogen too. Males have estrogen, so is your estrogen too high, and is that impacting the way things are going on in the body? So that's one thing I would say, just kind of figuring out what the root cause is or what's going on underlying that could be causing that. And then in terms of things to help out with that, there are like B vitamins, B complex vitamins are really good just to give your body general support, helping out with supporting the processes in the body and supporting hormone health as well. So that's something I would recommend. In terms of foods, you want to focus on things that are like whole food based, limiting sugar, limiting greasy and fatty foods that can be contributing to things like heart disease, high cholesterol, which can then indirectly impact erection and cause erectile dysfunction. What else? Arginine. Arginine is an amino acid, so you can specifically get arginine itself, like as a capsule form, and that's been proven to be helpful for that because it can help with increasing blood flow. So arginine's good for that. Those are like the main ones that I would say, looking at your diet, seeing if there's anything underlying going on, a B complex, and then arginine. But great question. Yeah, hopefully that was helpful. And if you have any follow-up questions, let me know. And if you're just dropping by, welcome to Let's Talk Health. I'm Dr. Amanda. This is our health live Q&A. Okay, so I'll probably answer a couple more questions and then I will be signing off for tonight. So I will be here for a few more minutes. So if there's anything else you wanted to ask me, feel free to drop it in the chat. And then if not, we will chat again tomorrow. I do go live every night, so feel free to drop by. Make sure you are subscribed. That way you will get notified when I go live. If I'm not able to do a live, I can always write into my community post as well, just in case I'm not able to come on live, and I can let you guys know.
How can females lower testosterone levels and balance their estrogen? Is lion's mane really that good for mental clarity and function? If yes, what can someone do to assist with it? Thank you.
Great question. There's so many questions about lion's mane. Like pretty much every night, right? We've been getting a lion's mane question. So interesting. So you want to lower testosterone. For females. I mean, this can also be applicable to males if you have really high testosterone as well, because sometimes high testosterone, it also can cause concerns, but let's just say if we're talking specifically about females, so that was the question. So one thing is spearmint tea can be helpful for that. So drinking spearmint tea. Number 2 would be inositol. This is specifically for PCOS, but still, if you don't have PCOS, it can help with lowering testosterone, can help with supporting ovulation, so that way, your ovaries are working well and you're able to make estrogen and progesterone properly. But inositol can be beneficial. 3, I would look into if you have insulin resistance. Again, this is kind of more PCOS, but if you have insulin resistance, it can drive up testosterone levels. So that's one thing to look into. What else would we want to? I would also say looking into now with herbs like Vitex and other herbs for like hormone support, I would say just looking into them. Sometimes it doesn't work for everybody, but it can help with supporting like things like estrogen and progesterone. But just, you don't also want to say like, what's your cycle like? If you're having a pretty regular period cycle and everything else is normal, I wouldn't go and take something like this because then it could just disrupt things. I would say more so looking into these things. But that was that in terms of testosterone. And then your second question was about lion's mane. Honestly, I'm gonna be honest, like it's not something that's usually my go-to that I say, okay, take lion's mane to help with cognitive health. I'm not really sure why it's become more popular now because I've been getting a lot of questions about this, but yeah, it can help with it. It's similar to things like reishi is another good one. They're basically mushrooms that can support the immune system and support cognitive health. I would say, it's a fair option to take, but yesterday I talked about brain fog and fatigue a little bit, and some things that I would recommend generally that are helpful for that. So you can always go and check that out. But I think I talked a lot about omega-3s and B complexes and some of those rather than just jumping to one of these mushroom types. But I hope that was helpful. Let me know if you have any other follow-up questions. Comment them in the chat right now. I'm gonna hang around for another minute or so. And then also if you guys have just joined us or if you're new here, if you're not familiar with our channel, it's Let's Talk Health. I'm Dr. Amanda. I host a live Q&A and I answer your health questions. So I do appreciate it if you like the video, if you subscribe, and if you join the community.
If the person has PCOS, how can they reduce insulin resistance? From your experience, what makes sense?
Yeah, okay, so we talked about insulin resistance a couple of days ago. Go watch that live because I talked about it a lot, but I'm just gonna quickly kind of summarize what you can do. So inositol is really good for helping out with that, with the insulin resistance. Berberine is another supplement, but then it really just does come down to diet and lifestyle habits. So doing like a fast overnight can help with that. Making sure you're spacing out your meals like 4 hours apart so you're able to allow that insulin to come back down. I did a little graph on the video a few days ago, so you can go check that out. What else? Whatever you're choosing. So choosing high protein, high fats, and lower amount of carbohydrates and sugar can definitely be beneficial for helping out with insulin resistance. And then just getting your body moving. So going for a walk after you eat, getting some cardio and strength training into your routine. But great question. So I think we will wrap things up for tonight. If I didn't answer your question, be sure to just come back and ask me at another live stream. Like I said, I do host this every evening. If I'm not able to make it, I will drop the comment in the community. So make sure you are subscribed and you turn on notifications and join our health community. So I hope you all have a wonderful evening and a great day tomorrow on Monday, and I'll see you all next time. Bye for now.